You know that feeling, maybe slight panic, when your doctor asks about some medication you took ages ago,
Oh, yeah.
and you're just guessing, or maybe worse, they're digging through this huge pile of papers trying to find one note.
It happens all the time.
That exact frustration, that little window into the old world of paper medical records, well, that's what we're really digging into today.
Yeah.
We're exploring the big shift to electronic health records, EHRs, and why this digital move is, it's way more significant than just saving paper.
Absolutely. It's really about fundamentally changing how healthcare actually operates. We've looked at quite a bit of information that explores the nature and, the real impact of these EHR systems. And our mission here isn't just like defining terms. It's to pull out the key insights, what EHRs can really do, the advantages they offer compared to paper, and the challenges too.
Right.
Think of it as getting to the heart of why this digital transition is just so vital for healthcare today.
Okay, great. So let's start right there. EHR, electronic health record, we hear it constantly. What is it, practically speaking?
Okay, so at its core, an EHR is basically a systematized collection of health information for patients, for populations, stored electronically. Digital format.
Right.
But the really crucial thing to grasp is this isn't just, scanning old paper charts and saving them as files.
Oh, okay. That's what I always pictured.
Yeah, it's more than that. It's about structured digital data. So information is organized in a specific way.
Structured meaning?
Meaning it can be easily accessed, searched, analyzed in powerful ways, and importantly, shared securely.
It's not like a static piece of paper locked away in a cabinet. It's more dynamic, something that can be actively used, connected.
Exactly. That dynamic, connected nature is the fundamental difference compared to static paper records.
Okay.
And just to clear something up, you sometimes hear EMR, electronic medical record.
Yeah, what's the difference?
Yeah, well, EMRs usually refer to the digital records kept within, say, one doctor's office, internal use mostly.
Ah, okay.
EHRs, electronic health records, are designed for broader connectivity. The idea is for information to flow securely between different providers, different settings, hospitals, labs, specialists.
That seems like a really important distinction.
It is. It really dictates whether that patient info stays siloed in one clinic or if it can actually travel with the patient across their entire care journey, which, changes everything for integrated care.
That connectivity.
Yeah.
Being able to share information, it sounds like it could really change how patients are treated.
Mm-hmm.
What are some concrete things EHRs allow that paper just couldn't?
Yeah, this is where it gets really powerful. So EHRs let providers actively track your care medications, allergies, immunizations, the lot, and monitor health outcomes over time, like is your blood pressure improving, cholesterol level.
Okay, so seeing trends.
Exactly. But it's more than just tracking. EHRs can have proactive features built in, things like automatic alerts for potential drug interactions or reminders for important checkups or screenings.
Yeah.
You just don't get that kind of built-in clinical decision support from a static paper chart.
That makes total sense.
Yeah.
And I'm guessing the whole administrative side of things, appointments, billing that must be hugely different too.
Oh, absolutely. The efficiency gains can be substantial. EHRs allow for electronic ordering of tests, medications.
No more deciphering handwriting.
Hopefully less of it. And automated report generation, electronic delivery of lab results right into the system. Think of the time saved, the reduction in potential errors compared to handwritten orders and paper being shuffled around.
Yeah, definitely.
And on the billing side, yes, it can significantly speed things up and improve accuracy because the clinical information can be linked directly to the billing codes and systems.
So it's not just saving time, it actually makes things potentially safer and smoother for patients too.
That's the goal. Reduce admin burden should mean more time for actual patient care. Faster results, maybe quicker diagnoses, a more responsive system, hopefully.
You mentioned sharing between providers earlier. That brings us to Health Information Exchange, HIE. Sounds a bit technical.
It does sound technical, yeah, but the basic idea is pretty simple. HIE is just the electronic movement of health info between different healthcare organizations.
Okay.
So the specialist you're seeing can securely pull up relevant notes from your primary doctor. Or an ER doc can quickly see your current meds list if you come in.
That seems crucial in an emergency.
Absolutely life-saving, potentially. And the way this sharing happens is evolving, too. We used to have more like point-to-point connections. Think of like dedicated phone lines connecting just two specific places.
Okay, limited.
Right. Now the trend is towards a many-to-many model. more like a secure network like the internet, where many different authorized providers can share information through a common secure infrastructure.
So moving away from those information silos where each doctor only knew their piece of the puzzle.
Exactly. Towards a more complete, holistic view of the patient's health.
And how does that actually improve things for, us, the patients?
Well, the impact on care quality and coordination can be pretty direct. With that fuller picture available through HIE, providers can make better informed decisions.
Like avoiding duplicate tests.
Precisely. Fewer redundant tests, maybe fewer unnecessary specialist referrals, and transitions like going home from the hospital, much smoother if your primary doctor gets the discharge summary electronically quickly.
Makes sense.
And like we said, emergencies are a huge one. But also, HIE can boost preventive care. Better access to all your test results, identifying maybe what's missing, using evidence-based guidelines. It all helps.
Those are really significant upsides. Thinking about the long haul, what about keeping these records safe? Paper fades, gets lost.
Yeah, that's a really important point. Health records often need to be kept for a very long time, decades sometimes, for legal and continuity of care reasons.
Yeah.
Digital formats just inherently last longer than paper.
Right. No fading ink or crumbling paper.
Exactly. Plus, there are big projects underway in many places to digitize older paper records, bringing that historical data into the digital realm.
So preserving history, but also making it usable.
Right, and freeing up tons of physical storage space, too. It's a shift from just storing records reactively to proactively using that data. Paper gives you a snapshot. EHRs give you this dynamic longitudinal view that can help spot trends, personalize treatments.
Okay, so the potential benefits seem, well, pretty massive on paper, no pun intended.
Right.
But we do hear about frustrations, challenges with EHRs in the real world. Is it always as smooth as the theory suggests?
That's a very fair question. And no, the reality is definitely more complex. There's still quite a bit of debate in the healthcare world about whether EHRs consistently lead to better care than, say, a really well-organized paper system across the board.
Oh, interesting. So it's not a settled matter.
Not entirely. Some studies have questioned the overall impact on care quality, but it's also really important to point out specific areas where clear benefits have been shown. Well, for instance, there's good research showing that practices using EHRs often achieve better results in managing chronic conditions like diabetes, better tracking, better adherence to guidelines.
Okay, so maybe it's particularly good for certain types of care.
That could be part of it. It suggests EHRs aren't some magic bullet, but in specific contexts with good implementation, they demonstrably help. It's nuanced.
Right. And what about the people using these systems every day? The doctors, the nurses? We hear complaints about clicking boxes.
Yes, that's a major part of the conversation. A common issue is the increased documentation burden. It sounds counterintuitive, right? You'd think shared records mean less repeated work.
Yeah.
But in practice, many physicians report spending more time on documentation with EHRs than they did with paper. Lots of clicking, navigating screens.
So it can actually slow them down.
It often impacts physician productivity, especially initially. Now, things like good voice recognition technology could help streamline this.
Talking instead of typing.
Exactly, that holds promise. But finding EHR interfaces that are genuinely intuitive and actually boost productivity, that's still rarer than we'd like. And there's also the cognitive load, just the mental effort of learning and using a complex new system, especially during rollout.
So more mental energy spent on the computer, potentially less on the patient interaction.
That's the concern, yes. While the potential for efficiency is there, the day-to-day reality for clinicians can be demanding.
Okay, let's shift back to us, the patients. How has this digital move changed our access, our control over our own health information? Paper records felt very much like the doctor's property.
This is a huge shift, really fundamental. Traditionally, yes, paper records were provider-centric. Digital systems are enabling a massive move towards patient empowerment, greater access, greater control.
How does that work in practice?
Well, take systems like the Ayushman Bharat Health Accounts, ABHA in India as an example. The core idea there is that the individual owns their health data and controls who gets to see it.
So I decide who sees my records.
Exactly. Sharing requires your explicit consent. It flips the old model.
That sounds incredibly empowering. What are the implications of patients having that kind of ownership?
Well, it can foster much greater transparency, build trust. When you're actively involved in managing your own health information, you tend to be more engaged in your care overall.
Makes sense. You feel more involved.
Yeah, better adherence to treatment plans, maybe asking better questions. It encourages a more collaborative partnership with your providers.
So it's not like once it's digital, it's just out there for anyone. There are patient controls.
Absolutely critical. And that consent can often be granular,
What do you mean?
meaning you might choose to share, say, only your latest lab results with a new specialist, not your entire history from birth.
Ah, okay. You can pick and choose.
Right. Now, your doctors will likely recommend sharing everything relevant for the best care, obviously, but the ultimate decision is yours. This directly addresses a lot of the valid privacy concerns people have about digital health data.
That increased patient control, plus the potential for better coordinated care we talked about.
Yeah,
It really underscores why this digital shift is so significant.
it really does. When you look at the whole picture, moving to digital health records isn't just changing the format. It's a fundamental transformation of healthcare.
Yeah.
It unlocks new capabilities for better quality, better coordination, more efficiency. Now, are there challenges? Absolutely. Implementation, workflow issues, ensuring robust patient control and privacy, those are ongoing efforts.
Sure.
But that digital foundation laid by EHRs, it enables things that were simply impossible with paper. And it paves the way for all sorts of future innovations in health tech.
So wrapping this up, our deep dives today really shows that shifting from paper to EHRs is, well, it's complicated, but it's a truly profound change for healthcare.
Definitely.
There are real hurdles, yes, but the potential for better, more efficient care, and crucially, more patient empowerment makes going digital a fundamental step forward.
Couldn't agree more. And it really leaves you thinking, doesn't it? As these digital records become even more integrated into everything, how might you, as a patient, interact with your own health data differently in the future? What new ways might emerge for you to proactively manage your own well-being, working even more closely with your care team?